is a video for anyone who's had any abdominal surgery like a DIEP, reconstruction, where you're having tissue taken out of your belly to make new breasts. It often leaves a really long scar, and sometimes the abdominal can feel quite tight. The lymphatics can sort of get a bit trapped around that scar, might get a bit spongy, a bit of edema gathering around there. But just keep this nice and soft and keep the lymphatics nice and open. I'm just going to show you how to do some lymphatic pumping, which is going to ignite all the lymphatics in the belly, and also to then do a little bit of lymphatic drainage. And on a separate video, I'm going to show you some scar work to do as well. So first of all, we're going to do some pumping above the collarbones. Now I'm going to show you a sort of quick version, but you can do each pump like 5 to 10 times. I'm just going to do a couple of times each position, just so you can see where it is. But feel free to do more when you do it yourself. So while you're doing lymphatic pumping, taking some nice belly breaths. So the diaphragm, when it squeezes all the deep lymphatics in the belly, gets all the lymph opened up. Okay, so you're going to find your collarbones, cross your hands over. There's two little sort of soft patches just above your collarbones. You're going to do an on-off pressure there while taking some deep belly breaths. You're going to go behind your ears, pumping on-off pressure behind your ears or just underneath your ears. Follow that down with a little squeeze of the skin down the sternocleidomastoid, this big thick muscle here. It's got some good lymphatics behind there, behind the occiput, just behind the skull. Little pumps there. You're going to pump underneath your armpit, your axilla. Especially if you've had the DIEP and you've also had lymph nodes probably removed underneath your arm. Okay, 5 to 10 times. Okay, and the mediastinal nodes just above the sternum. Remembering to take deep breaths every now and again. Okay, so now we're going to do a little bit of belly breathing on the tummy. So you're going to have 4 positions just underneath the rib cage there, and then 2 just in between the rib cage, the hip bones. So breathing into your hands, breathing out, following in with a little bit of pressure. When you breathe in next, you're going to resist with your hands, but allow the hands to move. And out, follow back in with a bit of pressure. Holding the pressure as you breathe in, resist against your hands, but allowing your tummy to win. And out. Breathing into your hand, new position. Resist with your hand. Push with your breath and out. New position just above the hip bone, breathing into your hand. Breathing out, following in with a bit of pressure. Resist as you breathe in, resist with your hand. And out. Last position, breathing into your hands, allowing your belly to go up and breathing out. Breathing into your hand, resist, and out. And now you've got some inguinal nose just next to your panty line there, so using the paddle of your hand, you're just going to do some on-off pressure in the lymph nodes at the corner of your panty line there, all the way along. Okay, so we've opened up all the lymphatics. So now you imagine your DIEP or your tummy tuck scar is right down at your panty line down there. So we're going to start doing some strokes downwards, directing the fluid over the scar and down into the inguinal nodes, so just below the scar. So just sweeping. This obviously you're going to do this on skin. You're not going to do it through the clothes like I am here. All right, coming around the hip. It's always starting low, because then if there is edema that's sort of trapping down there, you're sort of clearing that pathway before any of the rest can clear. So anything below the belly button is going to drain down to here, or into the deeper channels. Anything above is going to more come up into the axilla. So today we're focusing on this lower portion, which is where the skin has been pulled tight after the tummy tuck or the DIEP, and a new umbilical belly button made as well. So often it can get really hard and stiff on there. So you're starting low, dragging. This is all done without cream because you want that sort of tissue drag. Okay, around the hips, working over the scar. So now you're going to do a little bit of scar work. I'll do a separate video for the scar work, but you know, little circles. And you are you're not going to hurt yourself, but you are trying to affect the tissue underneath the scar. Okay, so I'm working all along the scar line with like on, off pressure with the circles. All right, then let's do a little bit of lymphatic. Push it through that scar. Sometimes the scars can act like a bit of a dam. Okay, around the hips, little pumps around the lymph nodes again. Deep breath. Now just work your way up. Working your way down, over the hip, down past the belly button. Okay, loosening the scar. So trying to affect the scar where you're lifting it underneath it, lifting on top of it, trying to pick it up, either side of it. All right, and then pushing the fluid down through the scar, all around, and push it down and pumping. Now working around the belly button, doing some scar work around the belly button, you know, little circles, grab it. Scars, the new belly button is just like another scar as well, so you know, make sure you're picking it up, moving all the tissue around it. Okay, so you've done your lymphatics. Do your pumping at the end. Okay, now you're going to get some cream, add it to your belly, and you're going to do some sort of deep kneading into your belly. All right, put my trousers down so you can see a bit. Sometimes this can get really hard and firm, all this tissue. So, you know, give it some good massage. Hard to do standing up, your arms ache a bit, so it's probably best to do it lying down. Put lots of big circles all around. You know, you want to sort of go in the direction that the colon goes anyway, which is always just to help that bowel motion. All the way down. So the bowel goes down the left side, up the right side, underneath the rib cage, colon comes across and down. So you may as well go in that direction, because then we're killing two birds with one stone. All right, get underneath the ribs, massage, massage, massage. You can do that for 5 minutes, just trying to soften that sort of fascia and tissue. You know, it has been sort of pulled really tight and sometimes seemed hard to stand up. So you just want to soften that and, you know, help that just to stretch out. I'll also do some videos where you can see just to help open up this sort of area and all this fascial chain through here. All right, so you've done your massage, you've done your lymphatic pumping, you've done your lymphatic drainage, you've done a bit of scar work, and you've added your cream, and you've done your belly massage, and then the final strokes, you know, make sure you're going down towards, from underneath the belly button down towards the inguinals again, above the belly button, you know, drag it underneath the ribs and drag it up into the axilla. All right, so above the belly button goes up, below the belly button goes down. And then the pumping at the end, more breathing, 4 positions. Okay, with the resistance, pumping underneath the armpits, mediastinal, collarbones, neck. Look, I've rushed through that, but you get the gist of it. And, you know, really you should be doing that every day if you can. You know, once your scar has healed, after sort of 6 weeks after surgery, especially when it's tight and there might be a bit of deep odema there, really good to do that every day if you can. Get it into your routine somewhere, and that will really help. And then, you know, if you can get to see someone like myself, an oncology massage and scar therapist or lymphedema physio, and they can help give you some advice on compression or help some if there is some really deep swelling there as well. So okay, all the best. Cheers.